Good afternoon. There's an echo in here. Good afternoon. It is Monday, February 6th, and the council is sitting for a state legislative briefing and update. And I will turn it over to our team to walk us through all the exciting updates that have been happening in Annapolis.
Good afternoon, Council President, Council members. Here with me today, as always, is our team from OIR. We had the opportunity to go through and review bills that were aligned with the county's priority and bills of interest as well. And so in your packet today is a chart that provides just detailed description for each bill and priority. I'm happy to go through that if there's not any other opening comments or questions.
I think we're good if we want to walk through.
Great. Happy to start on circle number 1, House Bill 283, Maryland Medical Assistance Program, Gender Affirming Treatment, introduced by Delegate Kaiser and several other sponsors as well. Fits within our HHS priority, and so essentially the bill would expand Medicaid services to provide gender affirming treatment in a non-discriminatory manner. Gender affirming treatment is medically necessary, including transgender, non-binary, intersex, two-spirit, and other gender diverse individuals. This would align with services that's already being provided by health insurers, and staff recommendation for this is to support House Bill 283.
Incredibly important, and clearly I support this, and I know that Councilmember Stewart does too and would like to speak.
Yes, thank you. I want to first thank the staff for adding this today and ask my colleagues to support this as a priority. As was noted, basically what this does is just bring Maryland into compliance with federal legal guidelines, and it ensures that Maryland Medicaid offers comprehensive health care coverage to our transgender community. Just to note that other states also already have this in place, every place from Virginia, California, New York, Massachusetts, and a number of others. And that this is really needed to reduce discrimination in our healthcare field and to make sure that members who are trans in our community are receiving the care they need. In addition, I just want to also say that major medical associations, including AMA, American Psychiatric Association, and the American Academy of Pediatrics, support this legislation, and in particular want to emphasize the American Academy of Pediatrics. And given the impact on young people who are transitioning, who can't get access to care, and the increases in suicide among trans youth, and given the country we're living in right now, I think in the state of Maryland we need to do all that's possible to make sure that our residents, and particularly our trans youth, have access to care. So thank you.
We are an inclusive and affirming place and need medical care to support that. Thank you. Councilmember Mink.
Yeah, thank you so much, and I really appreciate Councilmember Stewart making sure this ended up on the agenda. This is an incredibly important issue, and I will just add that we are seeing red states all across the country who are moving in the opposite direction, who are moving against science and also the general will of the public, and bringing a lot of discriminatory bills and policies to bear against trans and gender nonconforming folks. And so I absolutely am excited to see this piece moving forward in Maryland. We in the blue states have a real responsibility here to be acting with the same sense of urgency to protect and support the transgender community that clearly the red states are feeling to move in the opposite direction. And we're just not really seeing that as a trend yet. So I'm hoping to see this and the other related bill move forward, and hopeful that I know that all of our colleagues will support these initiatives, and eager to raise our voices as loudly as possible. Thanks.
Thank you both for speaking up and putting context around this important legislation, and gather there is full support for it. So without objection, we'll support.
Thank you. Moving on to House Bill 454, Health Occupations Licensing Certificates and Registration for Immigrants. There is a cross-file for this bill also. It's Senate Bill 187. It's not noted here in the chart, but there is a cross-file for this bill. So essentially, this bill would prohibit health occupations boards from denying a license, certification, or registration to an immigrant if they meet all needs in terms of education, training, or professional requirements for a licensor. It also gives the option for the applicant to include their TIN number, tax identification number, if they do not have a Social Security number. Essentially, the bill provides greater flexibility and reduces barriers for non-citizens to acquire a license. And this would address the healthcare workforce shortage. It would increase the pool of applicants and medical providers. Staff recommends support for this bill.
Thank you. Councilmember Fani Gonzalez.
Yes, thank you so much for bringing up this bill. I brought it up a while back, and thank you for remembering that. I spoke to Delegate Lopez about it, and she has my full support. We do have a workforce shortage on healthcare, and this is going to help a lot. There are a lot of people living in my district who were doctors and nurses in their home countries, and then they come here and they want to continue with that profession, and this will help them. So thank you for that, and I hope everybody can support it.
I suspect we will, so we will support without objection.
Forgot to note, Council President, that all the bills that are provided here in the chart are supported by the county executive, one of the confirmations that we got. So I just wanted to note that here just throughout the packet. Moving on, circle number 2, House Bill 274, Task Force on Reducing Emergency Department Wait Times. This would establish a task force that would look at best practices for reducing the emergency department wait time. This has been an important issue that has affected residents in the county. But there is a recommendation to support with amendments, and the amendment here would to include for the task force to include or expand its membership for the local government. Right now, the way how the bill is written, it includes a member and a senate, a member delegate and a senate. Also includes for the Maryland Hospital Association and advocacy organization. But we thought it was important to recommend support for amendment, and the amendment would be to add a local membership on that task force.
Thank you. Chair Albernas.
Thank you, Mr. President. I appreciate these efforts, absolutely concur with that recommendation and friendly amendment. And we took this up in the Health and Human Services Committee last year, but it's an issue that we need to revisit once again. What precipitated the request for that session was an experience that I had doing a ride-along with our fire and rescue squad, in which they talked about a code blue, which is when every bed in an emergency room within a Montgomery County hospital is full. And they had indicated that we are more in code blue than we are not in code blue, 7 days a week. And so this is clearly an issue that we need to tackle. And I'm very happy that this is being tackled at the state level as well, because there's only so much we can do here systemically at the local level without support from the state. So this is a good step forward.
Thank you. Councilmember Sales.
Thank you, President Glass. Oops, wrong one. Thank you, President Glass. Just wanted to concur with Chairman Albanaz, and also wanted to note that since we could have a local participation, I'm not sure about the health organization that's going to be participating with mental health, on the rise. And I'm glad to see Jody Finkelstein here from the Commission for Women at the Women's Legislative Briefing. When we did our roundtable discussions, mental health was a common theme across all of the discussions, from economic barriers to all the discussions. And so I'm hoping that as we're making amendments that we prioritize the mental health component.
Thank you. Councilmember Stewart.
Great, thank you. I just had a question on the amendment language where it says to expand membership to include local government. One of the questions I have is, or comments, is to make sure it doesn't just specify county, but that if there's a municipality that would be appropriate to include, that they're not excluded from this. Having been the mayor of a city that had a hospital in it, I think that's important. And just sometimes when these things get written, people forget about the municipality. So,
and I appreciate you raising that. I was going to ask whether it specifies a member from either MACO or the Maryland Municipal League. Okay, so might be something to suggest later. Okay, Councilmember Ludke.
Thank you. So in looking at the composition of who should be on this task force and following up on Councilmember Albernaz's comments, I'm astonished that they're talking about emergency room wait times, which of course have an adverse impact on our fire and rescue services, without having a representative from MIMS on the task force, and would request that we add that someone from MIMS should be participating on the task force, because if you have nowhere to transport, and this is an ongoing issue, and with respect to local governments, county or municipal, of course they're not going to have 24 different counties represented and 24, all the many more than 24 municipalities. But these are regionally impacted issues, right? Because our EMS services and our ability to place people within a hospital don't stop at a particular border. We've got to get them somewhere. And so then there are cascading impacts across county lines. There may be a need, and this is not uncommon in other state legislation, to have it regionally based, or to make sure that you have counties of different or municipalities of different sizes represented, because rural issues are different than Central Maryland's issues, then are different from the shore where they're having to transport people over and back and forth over the Bay Bridge, etc. So those are some things that I think we should be mindful of when we're advocating for local government and making sure we're getting the best possible outcomes from this task force. Thank you.
Thank you. Councilmember Mink.
Thank you. Great points from my colleagues. Just wanted to draw your attention to language in HB 109, which we will get to, where they talk about membership on the task force there, and it includes one representative of MACO, one representative of each of the 4 largest counties, including Baltimore City, 4 representatives of small counties that are geographically diverse, 1 representative of the Maryland Municipal League, 2 representatives of municipalities, and then some other representatives that, to Councilmember Ludicke's point, are specific to the issue at hand. So there's a model in HB 109 that may be helpful.
Thank you for sharing that. That is exactly sums up the sentiments that everybody has shared. So thank you, Councilmember Mink. So sounds like we will support, and whether or not it is with these friendly amendments to the sponsors, but if it's enumerated in a companion bill, I think that works just as well. Thank you.
Just to clarify, the companion bill is not related to EMS. It's just, Councilmember was trying to say there, see, like we said, there's many other examples here.
Yes, that was an environmental
bill.
Our team understands the sense of the council.
I appreciate Councilmember Mink raising that. I also noted that while going through the bill, very similar language, and so they're unrelated, but the language that's in there is something that we can look at as a friendly amendment for House Bill 274.
Great.
Moving on, Senate Bill 365, that's the Health Insurance Qualified Resident Enrollment Program Access to Care Act, introduced by Senator Lamb. It would alter the purpose of the Maryland Health Benefit Exchange Fund to include a provision for funding for the establishment and operation of the Qualified Resident Enrollment Program. Essentially, this would have a positive impact for county residents who are non-citizens, offering an affordable health insurance option. Currently, the only option for non-citizens to get health insurance is through a private plan. Staff recommends support for this for Senate Bill 365.
Support without objection.
House Bill 109, it's a task force on recycling policy and recycling and waste systems in Maryland. This would establish a task force, which we just talked about, and the task force would, although the county leads when it comes to recycling and diversion programs, there's still opportunity to look into best practice when it comes to food scraps. And so the recommendation here is for support, looking at best practices here, to look at recommendations that the county can use to support, and look at any feasibility and recommendations to reduce our greenhouse gases in the county as well. As mentioned, this does have an opportunity for a representative from one of the 4 largest counties in the state, and this would align with Montgomery County possibly having a seat on there.
Very good. Councilmember Sales.
Thank you, Council President Glass. I attended an event over the weekend with the Progressive Maryland organization, and they now have a task force on the environment looking at the public health impacts of incinerators. And I know that the Dickerson incinerator has been long-standing issue in our community. They're looking at the incinerator in Baltimore, and I believe there has been a study that was released in an op-ed in Baltimore, but I don't know if we've looked at the health impacts in the surrounding areas of the incinerator. So I'm glad that this is being advanced, and I hope that we get some tangible details about some alternatives of how to transition from this facility. Thank you.
Thank you. And I'll also add that over the last 3 years, the DEP has implemented a pilot program for recycling food scraps. The community in Silver Spring and a community in Potomac, each with about 1,000 customers, residential households have been participating, and the demand has been exceeded. And so that I expect the county executive and DEP and us to want to expand that program. And I'm glad Delegate Love wants to do similar efforts statewide. So support without objection.
Our next environmental bill is House Bill 230, Department of Environment, Zero Emission Medium and Heavy Duty Vehicles. This bill would actually establish for the Department of Environment to adopt regulations before December 1st, 2023, establishing a new zero emission medium and heavy duty vehicles in the state. The bill doesn't actually outline the actual target or measurements, but it does relate to adopting or incorporating California's a resource board on vehicles and standards. California has adopted and will be incorporating zero emissions for their medium and heavy duty vehicles. This aligns with the county's to meet its greenhouse gases reduction, and council staff here is to support House Bill 230.
Support without objection.
We have one bill that fits within our priority for election. That's House Bill 535, ballots, processing, and reporting procedures. Previously, the county's priorities letter recommends to support legislation that was vetoed last year by the prior governor that would authorize earlier canvassing of absentee ballots. So House Bill 535 does that. It actually provides the curing of errors that's on a ballot, and it also repeals certain statements and allows for procedures for canvassing. Council staff recommends to support this. I do know OIR's memo has a little bit more details and goes into a lengthy process of it actually specifying the upgrades there. That would be for this bill, but support for House Bill 535.
I don't think anybody in the state, let alone voters of Montgomery County, want to have to undergo weeks and weeks of waiting, and so I think we unanimously support this.
Moving on to House Bill 495, that's the Early Childhood Development Child Care Scholarship Program. This would alter the calculation for the funding of the Child Care Scholarship Program beginning in fiscal year 2025, and it would limit circumstances in which a program may be frozen, and also in terms of reimbursement rates and income eligibility programs for co-payments that are required, co-payment levels that may be required. Council staff recommends to support House Bill 495.
Support without objection.
The remaining bills fit under our public safety priority, and so I'll start with Senate Bill 1. That's on page Circle 5. That's the Gun Safety Act of 2023, also called Criminal Law Wearing, Carrying, and Transporting Firearms Restriction. Essentially what this would do is prohibit a person from knowingly wearing, carrying, and transporting a firearm onto a real property of another unless the other has been given certain permission to the person or the public. This bill is actually consistent with the council's previous adoption of Council Bill 2122 that restricts gun possessions in or around places of public assembly within 100 feet of any public assembly. The definition of public assembly is very important because if you've noticed in the Supreme Court in the Bruin case was very particular of what was considered within that realm. One of the things I've noted, or I can speak to as well, is that for this bill it actually says within 100 feet of places of public accommodation. And so the question is whether or not there might be amendments offered to narrow it to make sure it fits within the Bruin Supreme Court's decision of what is acceptable. And so that I think might be offered by the sponsor, and just going to stop there if there's any questions. Otherwise, council staff recommends support for Senate Bill 1.
Thank you. Councilmember Albornoz.
Thank you. So the last council acted quickly in light of the Supreme Court's decision, hoping that the state would pick this up during the General Assembly session, because it would make sense for all local jurisdictions to have the same policy in place so that neighboring jurisdictions and residents wouldn't be confused whether they're traveling within counties. So I very much appreciate Senator Waldstreicher's leadership on this, and I know he has been working with his colleagues both in the Senate and the House. And so I think we should support this for sure. There was a question even at the local level with regards to the definition of public spaces, which remains an open question. But the previous council, and I suspect this one as well, wants to push the envelope because clearly this is an issue that impacts all of us, and we should know whether or not the person sitting next to us or standing next to us is carrying a concealed weapon. And so that's something that I think is important for us to pursue. And we must work aggressively with the state to pursue any and all responsible gun ownership policies here in Montgomery County and in the state.
Thank you. Councilmember Lutke.
I think the statistic was that the number of gun permits that's been issued since the Braun decision came down is more than 5 times what it normally is, which is astounding. And highly significant of the issues we're going to be dealing with for quite some time to come as a result of that decision, and making sure we have appropriate restrictions and guardrails. These are also challenging things for public safety professionals to manage when there are that many additional firearms that are in public places at public events. So it's critically important to protect all in that way. I anticipate that there will be amendments to this bill that are going to be quite necessary in order to flesh out and make sure that they're working within the parameters of both the Second Amendment and, of course, in the best interest of public health and public safety. So, you know, I definitely support the bill, but understand that there are going to need to be additional clarifications because you may, in fact, have a residence that's within 100 feet of a place of a public accommodation, for example, and you can't then prevent a homeowner who does want to have a firearm in their home or carry to not be able to do so on their own property, for example, right? So there are some things that need to be fleshed out in order to make this all work and gel together appropriately. But there are very needed boundaries on this. So thank you.
Appreciate that analysis, and we all support without objection.
House Bill 162, Firearms, Maryland Voluntary Do Not Sell Firearm Registry Establishment. This would require the Department of State to create and maintain a Maryland Voluntary Do Not Sell Firearm Registry in which a person may voluntarily enroll for the purpose of being prohibited from obtaining a firearm. Essentially, this bill really is intended to be a suicide prevention measure by allowing individuals with mental health challenges to make decisions while they're clear-headed to protect themselves from moments in their lives where they're less steady. So the council staff recommendation here is to support. Do note that the public hearing did happen on February 1st last week.
Councilmember Lutke.
Thank you, Mr. President. You know, this falls into the bucket of we should do something because we should do something, but this doesn't get us where the bill's intention is trying to get us. And so if you read it in its totality, you can put yourself on, you can take yourself off. You can put yourself on, you can get back off in 21 days without caveat, without restriction. And so if you look at the comparable law that was passed with respect to gambling, for those who have gambling addiction issues, there are guardrails for those individuals. So if they do want to come off, that there is some sort of analysis. There is nothing built into here that gives that analysis at all. And that's highly concerning because while I understand the policy objective and I wholly support the policy objective, this doesn't get us there. And I think that that should be made clear. Thank you.
Thank you. Any objection to supporting? Okay, not hearing any. We'll support.
Turning to page or circle 6, chart Senate Bill 113, Civil Action, Public Nuisance, Firearm Industry Members. There's also a cross-file for this bill, House Bill 259. That is on the page 8 of this packet, so just want to let you know that those two bills should align. Essentially, this would prohibit firearm industry members from knowingly or recklessly creating or maintaining or contributing to a public nuisance through the sale, manufacture, distribution, or importation or marketing of a firearm-related product. Council staff recommends support for Senate Bill 113.
Support without objection.
House Bill 297, Criminal Law, Victims of Child Sex Trafficking and Human Trafficking, Safe Harbor and Service Response. This would alter the procedures that a law enforcement officer and a court are required to follow when the enforcement officer or court has reason to believe that the child who has been detained is a victim of sex trafficking or a victim of human trafficking. It also may provide that a minor may not be criminally prosecuted or proceeded against certain provisions. Council staff recommends support for House Bill 297.
Thank you. Public Safety Chair Katz.
Thank you very much, Mr. President. You know, Councilmember Lukey has said that there's certain things that when we think about them, this really is a no-brainer. Somebody who was being victimized would be victimized a second time if they were arrested for telling the truth, for getting themselves out of a horrible situation. So this is something that we absolutely need to be supportive of. So thank you very much to my colleagues for including this today. Thank you, Mr. President.
Thank you. Councilmember Mink.
Absolutely want to support this. Just wanted to ask a question. So in 2015, the county enacted Bill 3915, which makes purchasing prostitution a violation of county law, it's selling or buying prostitution violates the current state criminal law. Wanted to see how the state bill interrelates with this bill, and is anybody able to speak to that by any
Ms.
chance?
Finkelstein, if you feel comfortable, you want to join us?
Good afternoon. I'm certainly not Melanie. My name is Jody Finkelstein. I'm with the Human Trafficking Prevention Committee and also the Montgomery County Commission for Women. Thank you for that question. This bill specifically relates to minors.
Okay. Thank you.
Very important distinction and good question. Thank you. So we will support without objection.
House Bill 367, Vehicle Laws, Stop Sign Monitoring Systems Authorization. The sponsor here is Delegate Charkoudian. Authorizing local jurisdictions to use a stop sign monitoring system if authorized by local law and if the local jurisdictions contain certain public engagement and perform certain actions. It does prohibit a civil penalty for a violation recorded by a stop sign for exceeding certain amounts. The penalties can be collected distributed to the Department of Transportation for the benefit of the Complete Streets program. This is enabling legislation, and the council's staff recommendation here is to support. Should note that DC has a similar program but has some challenges with some of their technology and that they're still working through.
I'm aware of DC's program because I know people who have challenges stopping at those stop signs. Not me, but people have complained and have asked if not, why does Maryland not have that? And this is enabling legislation. Councilmember Friedson.
Thank you. I support this, appreciate the sponsors' work on this. I'm just curious how the income-based aspect of this would work generally when you issue a ticket to the driver of the vehicle. There's certain standards based on that. We don't know exactly who's driving a vehicle at a certain point. I'm just wondering how if we know how that is envisioned to work or how we would expect that to work.
I don't think that's been addressed from what I understand with the bill, and there's no cross-file at this point, and the hearing is upcoming. But there was some concern about just the large number of potential violations that could happen with this kind of technology. So it would almost have to be something on the back end when the citations are being processed, assuming the county goes with this, but when the citations are being processed, that there would have to be certain numbers of citations that are then deleted. That may not completely answer your question, but I don't think that has been.
So either there's a waiver that you can request and you get notice when you get it that if you qualify and make under a certain amount, you can request a waiver, or there's some listing of income tax standards that it would go through, but I guess that would have to be worked out if if this passes and then we actually ultimately implemented it. But that would be a big administrative question that we would have to work through, and I think this would be challenging to do, but I think it's worth at least looking into and exploring. So I just wanted to ask that question. I appreciate it. I'm supportive of seeing where this goes and then ultimately having those conversations at the appropriate time. I'll yield back.
Yeah, no, I appreciate the question, and clearly there are details of the proposal that need to be worked out, but I think the underlying goal is to get people to stop at stop signs. And that is something that I support, and I see everyone else nodding their head. So support without objection, but clearly we'll follow the conversation.
House Bill 451, that's drunk driving offenses ignition interlock system program. This would require the MBA to require a person who's convicted or of granted probation before judgment, also known as PBJ, that they would be required to participate in the program that would have an ignition interlock system for certain periods of time. Council staff recommends to support House Bill 451.
Support without objection.
As I mentioned, House Bill 259, we already discussed that. That cross-file was Senate Bill 113. So moving on to House Bill 426. This is the last bill for the council's consideration. That's the correctional facilities, transgender, non-binary, and intersex inmates, also known as the Transgender Respect Agency and Dignity Act. And this would require the Commissioner of Correction to report certain information regarding the gender identities of inmates and the housing status of transgender, non-binary, or intersex inmates. And it would also prohibit an employee of a correction facility from discriminating against inmates on the basis of a certain protected class. Council staff recommends to support House Bill 426.
Any comments? Nope. Support without objection.
That concludes our bill review for today. Just wanted to note that we will not have a session in 2 weeks. It'll be September 27th, towards the end of February, just because of the President's Day holiday that's coming up on the 19th.
And before we adjourn, I know that there have been a number of updates, things that we've been following that are moving. I don't know if they're ready for prime time, but are there any updates you want to share with us, given we won't have this conversation for another 2-3 weeks?
Just a couple of things I would share, and that's that the filing deadline in the Senate is tonight and in the House on Friday, so we're getting very close to seeing the complete grouping of bills that will be considered by the General Assembly this year. Also, the administration package is in. Someone's going to be very busy. Just saying. It's a big package. It's an aggressive package. It's got a lot of interesting things in it. It's been covered in the press fairly widely, so I would suggest that you look at some of the proposals that are out there by the administration. They're interesting. Also, the cannabis bill is out. It's an 88-page bill, so we're working our way through that. Again, there have been some press coverage of the big picture of what's in the bill, and this is likely going to be probably one of the biggest bills that will be taken up by the General Assembly this year, so we're looking forward to engaging in that conversation. Also, later on this afternoon, I will send you a list of the local bond initiatives that have been introduced so far. Those replace the local bond bill package. But they have the same purpose, and that's members of our state delegation putting forth capital grant requests for projects that are within the county jurisdiction, within the borders. So we'll send that on. It's a list so far of about 15 or 20 projects. We would expect that there would be more than that. So we'll send that on this afternoon to you, just for your information.
I appreciate that, Ms. Winger. Two things I'll just highlight for colleagues, that it's been shared with me that the cannabis bill does allocate 1.5% of revenue to counties and municipalities. So we'll see how that works through, what that looks like at the end of the day. And then also on Friday at the state delegation meeting, it was conveyed to me that there is movement to support the party affiliation changes on the planning board. can you fill us in on that?
I'll ask Kathleen to talk about that. We talked about it this morning with the county executive, what those amendments look like and what's going on with that piece of legislation.
Thank you.
Yes, thank you very much. Just so Ludie knows what we're talking about, this is the email that I had sent on Friday. Okay. Yeah, just so she knows what I'm talking about.
That one email.
Yeah, that one email. So yes, MCPG 10923, as it came in, would have deleted the requirement in current law that 2 of our 5 members of the planning board be from a different party than the other 3. No more than 3 can be of the same party. Okay. And it took that out so that all 5 could be of the same party. When the council first discussed that bill, your position was to support it with some additional diversity language, saying, okay, that's okay to take that out, but we'd like, the county's goal would be diversity in ethnicity, racial, gender, and political, and also it was added, disability was added in the delegation. So I think, Mr. President, what you're speaking about, that amendment was adopted. That amendment was adopted by the House delegation several weeks ago. But final vote on the bill was deferred because there was a strong feeling by a number of members of the delegation that actually that political party requirement was very important in terms of diversity. And so I know the chairman of our delegation, House delegation, Julie Polakovich-Carr, and Delegate Foley kind of went back and talked about how to respond to the concerns that were being expressed about the importance of political party affiliation. So the amendment that they adopted, the House delegation, they brought it to the House delegation. It actually didn't go to the committee. And so they adopted an amendment that says, essentially allows, if a county executive receives at least 80% of the votes cast at the last general election, it says not more than 4 commissioners may be of the same political party as the county executive. So in that circumstance, you could have up to 4 being of the same party. It also states the other part of that, which is if the county executive receives less than 80% of the votes cast, only 3. It goes back to current law. Only 3 members can be of the same party. So that amendment was adopted after discussions about, by a number of members about the importance of the political party representation.
I'd just like to say something in contrast. This is familiar too because there was a county requested piece of legislation for alcoholic beverage services that dealt with advisory group, and it started in the kind of same posture with a change of, removing the requirement and adding on the language to ensure diversity of the membership, and that bill did not advance. That bill is now dead in the state delegation.
So in summary, the legislation pegs the partisan makeup of the planning board to the electoral results of the county executive race in the general election as a percentage.
Yeah, that's
Okay.
correct.
And that would apply to Prince George's as well?
That's correct.
Okay.
And if that happens, there still has to be 1 person who's from a different party.
Sure.
Yeah. And in terms of action or for the council, Mr. President,
Mm-hmm.
the House having adopted it, House delegation, it will go to our Senate delegation, and they will ask us what is the county executive and county council's position on the amended bill.
And what is the timing of that? Because I'm hearing mixed emotions on the dais.
Yeah, we don't yet have a date for that, and
Okay.
we can convey that if there's to the Senate delegation if more time is needed.
Okay, very good. Well,
Sure.
keep us posted on that because I'm sure we'll weigh in. Anything else? Councilmember Balcom.
Yes, thank you. So once the deadlines have passed for filing, do you come back and talk about the bills that we've weighed in on and whether they're cross files or where they are? What's the next step in this process of how we interact?
Well, we'll continue. We have other meetings scheduled, so we'll continue to provide updates on everything that's going on and potentially, tell you how bills have changed through the process. Also, Ladine's table continues to get updated. I don't know how often that goes out to members, but yeah, we'll be back.
Okay.
And also, lots of times I will just send, if things are moving quickly, I'll send email updates of things that are going on, things that are relevant and have been taken up here with the council.
Right, because the closer we get to the end, it just speeds up so fast, and I don't know if we'll have time to weigh in on things that we might want to weigh in on.
There have been times I've sent updates by the hour. So we hope to provide opportunity for you to weigh in on the things that matter to you, certainly.
Great, thank you.
This is still the deliberative phase in Annapolis, and as things progress, it'll get fast and furious.
Yeah, and if there are positions that have changed within what was actually introduced or amendments, we will bring that back to the council. And so Mel and team keeps us apprised of that. But generally, if you support it and the bill is moving in the general direction that we believe that it's first introduced, it's not something that we'll typically bring back, but happy to, if a council member raises that, can do that. But the bills have changed, whether there's text or context or other things as well. That's something that we can bring back to the council.
Fantastic. Thank you all for these updates. I'm not seeing any other comments. We are adjourned.